Well, the overdose death of Angels pitcher Tyler Skaggs is a tragic part of a growing problem around the country.
We're going to talk about it right now. Clinical nurse specialist Alice Benjamin here to tell us a little bit more about this epidemic. We're talking about fentanyl and these other drugs and the problem when you combine them. Thanks for being here and shedding some light on this.
Yes, and what we do know is like the Centers of Disease Control says that there's over 70,000 deaths a year related to drug overdose. And that equates to about 192 deaths a day. And about 70% of these are related to opioids, which were involved in this particular case.
Well, fentanyl, though, is a prescribed medication for people in severe pain. I mean, so when you begin to mix them, let's say, with illicit drugs or with other prescription or prescribed medications, I mean, we're running into a very dangerous cocktail here, right?
Absolutely. And according to the autopsy report, he had fentanyl and oxycodone, which are both very powerful narcotics for severe pain. We don't typically prescribe those together, and it's unknown exactly how much was actually in the system, but also what was shared was that there was alcohol on board. So all three of those substances can be very dangerous by themselves, and in combination, lethal as it's been proven.
What does it do to your body, though?
Yeah, so all three substances are a suppressant. So when you take them, you feel relaxed, you have pain relief, and you feel good when you take them at, under supervision and then correctly.
Which is what they're for, if you have back surgery, et cetera. Okay.
Exactly. But when you combine the medications and the alcohol and you take them in larger quantities, it can actually lead to comas, suppression. It depresses your respiratory rate. It can cause nausea, vomiting. You lose your gag reflex. And so a multitude of things can happen, and it's very dangerous because, again, like I said, it suppresses your breathing.
Right.
And so it sounds like in this case he died of asphyxiation, which is a condition in which there's been a lack of oxygen due to abnormal breathing.
So how would you know if somebody is abusing drugs like this? Is there anything you can look for and maybe help someone before something terrible happens? Right.
We all need to be on the lookout for this. And hindsight's always 20/20, but I want to encourage people to get into people's business. I mean, especially your family and your friends. And you'll notice subtle changes. It might be slight behavioral or changes such as they're a little more irritable, a little more secretive about where they're going. They might be unkempt, a little body odor. Maybe they're overactive when they're usually more mellow, or maybe they're very, very tired when they're usually a lot more active. So some of these subtle things, and that's not to say that when you see that they're using drugs,
sure,
but be a caring citizen, family member, and inquire and see what's going on with your friends and family.
All right, Nurse Alice, we appreciate the insight and expertise here today.
Thank you.
Thank you.
All right, folks, 4 stories to watch tonight right here on NBC4. A private funeral was held today for the man